So today I'm going to talk about sperm motility and treatment in Chinese medicine for sperm-related issues. In our clinic, we get a number of patients who are coming in for evaluation for infertility, and a lot of times it's from the man's side, and it's problems with sperm. And there's a number of different things that doctors are checking for when they order sperm or semen analysis. And one of them is the sperm motility. And the sperm motility is basically looking at how well is the sperm able to travel and be able to move, because that's essential for the sperm to get all the way to the egg to do fertilization. And so that's one of the qualities that doctors look for when they check the semen analysis. And so we've had cases uh, low low sperm motility. And so I wanted to talk a little bit about it from a Chinese medicine perspective. In Chinese medicine, the sperm and the sperm quality is always to some degree related to the health of the kidneys. Pretty much always at some level related to the health of the kidneys. Now, it can also be, there could be other organs that have a deeper root problem that is secondarily affecting the kidneys. So you could have somebody who has a lung problem and their lung is the main organ that's weak, but then it secondarily affects the kidneys. And so then they have low sperm motility or poor sperm quality. You could have somebody who has a spleen problem that then secondarily affects the kidney, or a liver problem. There's a number of different ways that the disease can cascade down to having a kidney problem and resulting in a sperm problem. But usually at some level, the kidneys are affected to a certain degree. So the question is, when I see a patient, I'm trying to figure out what is the primary problem, what's the root problem that's going on here, and what's just the secondary thing. Because we get patients, and this is all the time, people come to the doctor for different reasons. A they may have something really bad with one of their organs, but they're actually going to a doctor for something else that they're more interested in fixing. So you may just always be tired and have fatigue, and you may have a spleen issue, but that's something that you never thought about going to the doctor for. But if it affects your kidneys and then it affects your sperm motility, then that might be something that you are actually seeking treatment for. So the reason that patients come to the doctor is not necessarily for their root problems. And so one of the things that we have to do in our clinic, and that I do when I see patients, is I have to separate what are they coming for from what's actually their root problem. And that's also hard to explain to patients, because treating the root problem sometimes seems like you're treating something that they're not really interested in fixing. They may not have seen that as a problem. And so part of what we do is try to explain to patients how the body's working together and what the underlying problems are. So I wanted to talk a little bit about sperm motility and kind of a case example of this. So a few months ago, had a patient coming in for treatment for sperm motility. And when I evaluated them, it turns out that both their spleen and their lungs were weak. And this was really crucial to making the right diagnosis. Their lungs are, the lung in Chinese medicine is the organ that helps to generate the kidneys. It helps to give strength and for the kidneys to then produce the work that they need to do. So if the lungs are weak, then the kidneys will subsequently be weak as well. And the spleen is actually the organ that helps support the lungs. So if you have weaknesses in both of those, it cascades down to affect the kidneys. So for this particular case, I used a couple different herbs, and one of the herbs involved was one of the formulas involved was a formula called Sijun Sitan. Now, this is a formula that really focuses on the spleen. And in this particular case, we also use herbs to help build up the lungs secondarily. And then actually the smallest part of the treatment and the smallest part of the herbs that we used were herbs to actually directly help the kidneys and help the um, build up the kidneys and help improve the sperm. But that was because the sperm motility problem was really in their situation a secondary, if not a tertiary, um, downstream effect of really the root problem, which was the spleen and the lungs. And so that's kind of an example of how we think about cases in Chinese medicine at our clinic, and that's kind of the approach that I use to treat my patients. And so this is very different from Western medicine and even a lot of alternative medicines. A lot of clinics you might go to, you walk in and you say you have a sperm problem, and they give you the sperm tablets, quick fix. And that may not be the same type of case for everybody. And so that's why it's really important to have somebody who can differentiate what's actually going on in your particular case. Because even though, like I said, sperm qualities are usually related to, at some level, the kidneys, it's not always the root problem. And so it's important to have somebody who can think through those different layers and really figure out what's going on underneath. So that's a little bit, just a quick example of how we used Si Jun Si Tang and to help treat and improve one of our patients' sperm motility. And we'll talk about more cases, and we'll see you next time.